Hi, my name is Dr. Adrienne Wood. I'm a naturopathic doctor in Windsor, Nova Scotia, Canada. And I'm here today to talk to my friend about PTSD. I'm quite interested and curious about PTSD and the treatment of it and the management of it. It's a population that I see often in my practice, and I'd like to get some more insights about somebody who actually has clinically been diagnosed with PTSD. Yeah.
That's right. Okay, thank you. So PTSD, according to the DSM-5, defined as trauma and stressor-related disorder after a traumatic event, and you generally have four types of behaviors. One is the intrusion, the flashbacks, or if the suppression of flashback will then go into nightmares. One is the avoidance. The avoidance is the big part of what I see in PTSD. Avoidance of anything that will remind you of the memory.
Mhm.
It's basically about I don't want to and cannot, and I'm not allowed to remember. And so you're avoiding anything. You're literally creating like a whole personality to avoid any reminder of the event to a very intense, it's a very intense, very obsessive level of suppression. So, which is why I say you end up creating a persona um,
Right.
to your whole life is designed around the avoidance of cues and clues and triggers is pretty
It becomes
strong,
all consuming.
all consuming. It's a very strong aspect of PTSD. There's negative alteration in cognition and mood. So basically, you have fear, shame, numbness. You don't care anymore. Like there's that numbness and anger. Because the event is about, usually, it's an intense emotion that brings up feelings that I don't matter, my well being don't matter. Or if you're a witness, then you see in what you're witnessing is how little somebody else matter.
Mhm.
How little your well-being matters. There's an intense experience of the abandonment
Mhm.
um, that the emotional intensity is pretty high. And then depending on how that person was um, groomed from conception onward on what to do with strong emotions, then that will create the rest of the framework. And then the fourth part of PTSD is the alteration in arousal and reactivity, which is hypervigilance. The hypervigilance will your amygdala actually gets smaller, your hippocampus shrinks, it changes your brain. And then over time, the hypervigilance requires a lot of cortisol. Your cortisol constantly comes up to manage the vigilance because that's the cortisol's job. And over time, you actually burn out cortisol, and then the health symptoms, autoimmune conditions, pain, they're due to low cortisol.
Mhm.
So as we continue talking, I'll come back to this topic of cortisol. So hypervigilance, which also go into a type of intense control,
Mhm.
very, very controlling, a very strong control aspect in themselves, which they may cover over with a very easygoing personality, but there's an intense control um, design that's got created out of the PTSD experience in order to avoid the memories.
So in my practice, I see a lot of people who are avoiding triggers and
Yes.
avoiding a lot of situations. I mean, not consciously, it's
No,
an
it's not conscious.
unconscious, but a lot of their lives are revolve around avoiding certain
Yes.
things that
Yes.
might upset them. And if they
Yes.
can't avoid it, they become quite enraged or quite
Yes.
upset.
Yes.
And there's a lot of hypervigilance
Yes.
in people and a lot of control issues. But
Yes.
these are people that I'm seeing. I mean, I certainly see that in populations who do have clinical PTSD diagnosis, but I
Yes.
see a lot of those hallmarks you just described in
Yes.
just kind of regular people.
Yes.
So who has PTSD and how do
Yeah.
you draw that line?
So it's about I do not want to remember an event. I do not want to remember. The desire to not remember creates the rest of it. So
So could, could you, like, would it be fair to say that the majority of
yeah,
people in our society
has
have
some
some
degree.
degree of PTSD? Because there's a lot of things that a lot of us don't want to remember from
Yes.
our past because
Yes.
it's painful. It might not necessarily be like a war
Yeah.
type event or some major traumatic tragedy,
Yeah.
but I talk to people every day where there's like there's things that they don't want to,
No.
might be a family dynamic or something, a way that they were treated by an adult in their environment or
Yeah.
something upsetting.
That's right. Is the
So
degree so the PTSD word got coined together, I think, after the Vietnam War, when they started to see particular population of people having all of these changes in their behavior. And until then, you can see how the society as a general has this attitude towards processing events, which means having all your emotion be released about each events. You can see how much we block everything. And it took some pretty intense changes among men coming back from war to then start to even investigate that is it even valid? Can we even make this legitimate, that this actually exists? So that's heartbreaking in a way to see what it took for us to even recognize that there's something here called changes in your behavior just because you're avoiding memories, which most children have go through these experiences. Like,
yeah, yeah, there's
yeah,
a lot. Yeah, I feel like most of us, I can't, I don't even think there would be a single person that doesn't have something that they want to avoid
exactly.
remembering.
Exactly. And you don't even know that you're trying to not remember.
Exactly, because those processes of avoidance and hypervigilance and
Yeah,
control are so ingrained.
so
We
ingrained.
might even think it's part of our personality.
A lot of the facades we have created in order to create a personality that's always avoiding reminders. It's a little scary to think about it, going, that's not even a real person.
Yeah,
I just created a personality that is about avoiding
that
triggers.
helps me avoid something.
And
Yeah,
and people think they're engaging with the real me when that's just a result of the avoidance of
yeah,
memories. And underneath it all is quite simple. It's about I don't want to remember.
yeah.
Yeah.
So if we go back to that example from the Vietnam War where, this started to become more socially acceptable, maybe to talk about out loud, this term. So,
Hmm.
we had this group of people, and not just the men that came back from the war, but the medics and the nurses and,
Yes,
like I think a lot of people had a lot of suffering from
absolutely.
that. So if we lived in a perfect world, well, I guess in a perfect world we wouldn't be going to war, but if we lived in a world where we knew a little bit more, and if we were applying some of God's laws to these people coming home with these pretty extreme traumatic memories,
Yes.
how, like, what would that look like to help people move through that, so they wouldn't hang on to this hypervigilance and avoidance? Like, what do you think that would look like? They arrive on a plane from Vietnam, they're back in Canada, they're back in the North America, and now what?
Yes. So it would be about normalizing that they're going to experience nightmares. They're going to experience flashbacks, like intrusive, call it intrusive thoughts, but they flashback of certain images that comes through because the brain is trying to come to terms with what happened
Mm-hmm.
and the way the brain process. So when I work with people with trauma, they will say after the event, say it was an accident, you keep going through it again and again and again, and you keep going into the what if, what if, what if. And I said that's the normal, healthy nervous system trying to sort things out. It's actually very healthy. Let it happen. And then I would have the person pay attention to what's changed, what's getting a little harder to do. so that they can recognize for themselves, I'm not okay. I'm not, I mean, you shouldn't be okay, but that my body is communicating to me that's an event I need to process. That's all it means. And to help the nervous system, if I speak from the perspective of the nervous system, is the nervous system trying to sort things out? Somehow you give yourself more permission that this is a biological event.
Yeah.
And and then mostly it's about creating either the medicine, the person, the place in which they can process overwhelming emotions. So sometimes if someone is in quite a bit of stress, and I have to point out here that in the avoidance, um, spirits will get involved. You're going to have spirit involvement, and spirits are just people who have passed away, who are still hanging around it. And then if you have a similar situation, like other people that have experienced, say, war situation and have passed away, they're going to come and hover with you. And then you start to have some symptoms that are because of the spirit interactions. So intense anxiety, nightmares, um, abuse, substance abuse, in order to keep suppressing. There's a lot of spirits that get involved. So sometimes what I'm treating is helping remove the spirit influence a little bit. So herbs, homeopathics, can really help with that. There's help in making sure the cortisol can come back, because sometimes you're accurately assessing, I don't have what it takes to process these events. You're actually assessing in yourself biologically. So in those moments, if I give some herbs, you can see the nervous system coming back and saying, I can do this. And for example, St. John's wort, I don't use it to improve serotonin. I use it because it strengthened the nervous system. Your nervous system starts to feel, I can cope. That's the biggest change.
And
And other herbs.
And so there's a difference then between, because what I'm hearing you say is, you know, if somebody's coming back with some traumatic event, their nervous system does need to process it, and
Absolutely.
through nightmares and through overwhelming emotions and releases,
Yeah,
that is how the body and the nervous system is processing that event.
that's
But
right.
what I see from the current medical system
Yeah.
and mental health system is often those things are prevented. People are put
Yes,
on heavy duty medications to stop the nightmares, to stop the overwhelming
intrusion.
emotions. And so it really just it stops the body from what it's naturally
Yes,
trying to do. But
yes,
you're saying that the herbs are acting differently than the
absolutely.
medications.
Absolutely.
Mhm.
And there's a language to explain to our patients that um, all the body's asking for is allow the emotions to move through. And of course, in the process, your soul, your consciousness is having to come to terms with what you saw and what it all means. It is forced into it. You have, you no longer have the luxury of having a very specific kind of life that is somewhat protected. You have been exposed to something, and now you have to come to terms with it. Even if you come to terms with that if I have a desire or I'm required to or forced to kill, there is something in the soul that just goes into pain from it. Doesn't matter which side of the argument you are on. So, for example, if you are working with um, first responders like police, they're required to kill. There have to be a willingness in you to kill. And that hurt, like that has an impact on the person's soul. And
Yeah.
that's part of the conflict that needs to work its way out, where you just have to allow the emotions to come through, because there is a penalty everyone feels whenever there is an actual killing. And then I also want to point out the PTSD that you get from witnessing.
Mhm.
Witnessing is very traumatizing. I know of people in violent childhood situation that say they prefer to take on the violence than to witness it happening to their family members. So So first aid responders, they are witnessing, and then there's a lot of demand from society on these first aid responders to shield us from what they're experiencing, which is reality. Accidents that, things looks really terrible. Fires, it's terrible what happens to properties, to humans, to the injuries. But we have a demand that they buffer us from having to be a part of that reality. So they feel a lot of pressure that they somehow have to hide what they're experiencing from everybody else who say, we can't cope with the emotion. So there's a lot of pressure on them to hold it in and to not acknowledge that this is earth-shattering experience over and over. So witnessing creates a lot of traumatic event for people to work through. So basically, we would change what we expect of first responders and change that every time someone come back from these experiences, expect about a week of an emotional experience where you're shaking all the time, you're crying, you can't sleep for a week, like you gotta go through all of it. Eventually, something will change. It'll get easier and shorter, but that's because you have changed. Something in you have changed, and you'll become a very different person from going through the process.
And that's a little hard to imagine in our current, like the way that things are currently set up to, let's say, for example, a paramedic, they have a 12-hour shift, and then they might potentially need a week, you're saying, to process what they've
Yes.
encountered on that shift before they can go back to work. But in our society, they work, I think it's like 4 on, 4 off or something, like, so
Wow.
they do 4 12-hour shifts back, essentially back to back to back, and then they only have 4 days here in Nova Scotia to just rest and recover, and then they're back at it. So
And you expect it to function in a family life or whatever life you may have in a
yeah,
society. You expect it to then go contribute to that.
yeah, so like that's quite this schedule, the structure that's been set
Yeah.
up for a lot of these people is like very unrealistic if we're talking about it in these terms.
Well, and we have a demand that they take on and buffer us from these experiences so
Do
that
you
we
think
don't.
that's why, like, veterans and first responders tend to have a very high level of PTSD clinically, diagnosed PTSD? Do you think that's part of the reason why?
Because they're expected to be stoic about it. Yeah,
Or
I
and to
absolutely.
protect the rest of the
Yeah,
population from, yeah. Do you
yeah.
think there's other reasons why those populations have higher levels of PTSD?
Well,
Or do they? I don't know. Maybe that's not even true.
fortunately, we are recognizing that certain population with certain experiences are allowed to have traumatic events.
Right.
It's allowed. If you start looking at children, and you'd be surprised or not at how much PTSD is going on among children, among certain cultural population. Um,
So
so
it's just more diagnosed
yes,
probably in those
fortunately.
populations.
I also wonder if because if you didn't experience, some folks when they have experienced a lot of trauma are drawn to traumatic work because you've been normalized to it. That's your
Uh,
normal.
Okay.
Some people, but then you're working in a field that burns you out so fast, now the symptoms can start to show up. For some
So it's
folks,
really more past trauma that's maybe some of these people have
yeah.
that's starting to come up. It's not even necessarily the current conditions.
Well, the current situation should be something you need to process anyway.
Yeah,
But then it kind of, you can no longer hide it.
right.
And the second type of population I'm thinking are people that were not exposed to very intense situation, or were, but when kind of like the normal childhood. And so they have not developed certain what's the word? There's a word for it, resilience. So
Mhm.
that now you're suddenly exposed to something that you were protected from your whole childhood, and now your nervous system have to come to terms with this whole new way of living you had never had to encounter before. You have not developed the resiliency. That can also be why the experience is so abrupt for those folks.
So what do you feel God, like, how do you feel God views PTSD in our current management of it? Have you connected with God about that or get any
I
feelings from your guide?
so the main emotion I want to speak of, the main emotion that comes up for people with PTSD, they're saying, okay, what is the work? Am I supposed to remember? I would say the main emotion is fear, the emotion of fear, processing the emotion of fear over and over and over. It doesn't matter where you're blocked in the journey, is the main emotion is fear.
Fear of what?
Any anything, the emotion is fear. It's like, well, I'm having a lot of flashbacks. What do I do with it? What's your fear? Or I'm feeling numb all the time. Well, that's anger, but what's your fear? And then I'm vigilant all the time. I'm irritable all the time. What's the fear? I personally have processed fear every day for the past 8 years, and now no longer have suicidal urges, no longer have intense pain, no longer have numbness. Every part of it, the main emotion I've released is fear. And a lot of the PTSD symptoms started to just disappear from just releasing the emotion of fear. But there will be a lot of fear to process, which again is not very normalized. I see a lot of my friends are able to tap into grief, and I'm like, sorry, I'm still at fear. A lot of fear, but it has done significant, the biggest change in PTSD symptoms for
And
myself. And
letting
then
yourself
also,
feel the fear.
yes, just fear of just anything and everything. And as you work through the emotion of fear, be willing to feel fear, then you'll be able to start to expose what the memories are and how terrible they are and how hard you're pushing it down. It'll take a lot of processing fear to access why I don't want to remember. And then it's very traumatizing to go through that layer before you even get to the memories. So there's quite a few steps, but you just have to be willing to feel the emotion of fear. It'll take you all the way through. And
So that's how we really heal
yes,
PTSD is letting ourselves feel the emotion of fear, so and eventually then connecting to the grief and the
yes,
pain
yes,
that we're afraid of, essentially, of feeling.
absolutely. And the emotions are very overwhelming. What I
And
felt,
once, sorry.
what I felt coming from God and my guides is it's the fear of experiencing intense emotions where your well-being didn't matter, where life was at stake, where the despair and hopelessness is all you see, is a fear of experiencing intense emotions. That's basically what I got. And of memories. Yeah, yeah. It's
But
always
if
about
we
memories.
do let ourselves experience that and feel that overwhelming, intense pain, then there would be no PTSD anymore.
No, I'm now willing to remember. Took years, and every step had processes I had to work through. So right now I can get a flashback, zings through me, and then I tell myself that was enough. Stop. And then because you're not supposed to re-experience the trauma, that's traumatizing.
Yeah.
You get a flash of it, and then I remove myself from the situation, create a different situation, and then I say, I can feel what I need to feel. Sometimes I'm just numb. And there's going to be a whole other level of rage that's going to come through. So rage can be very uncomfortable for me, and then you got to work through that. But I'm now willing to remember and to know that in just that one flash of a memory, I don't have to do the rest of the 10, 15 minutes of it. Just one is enough. Um, go through the physical shock of it. And then slowly, probably in a couple of years, I'll be able to stay in longer memories. Like, so I'm willing to remember. That was all it took, like a lot of work to take just to get to here.
Yeah.
So I want to people who have PTSD, don't put the pressure on yourself. I'm supposed to remember. There are a lot of layers to come through and skills to develop so that by the time I got to memories, I have a whole set of strategies I'm supposed to engage when it happens.
Right. It's like almost like you're building the capacity in
Absolutely.
yourself to
Absolutely.
eventually get to that point to do something hard. It's like almost like we start with the 5 pound
Yep.
dumbbells and then
Yep.
we eventually work up to, over many, many months or years to
Years.
like the big, being able to
Exactly.
lift. Yeah.
Exactly.
Because, and I think that's very there it's empowering to hear that because I've heard from people in the mental health uh, industry, no, world, that they don't think like PTSD can be cured. There is
I
that feeling in our society that there's no hope for these people,
No,
and
that's a terrible thing to
that's
do with somebody.
awful. And I imagine being a patient with PTSD and then potentially having a practitioner who I can feel believes that
Yeah.
there's no hope for me.
No,
Like
that's
how?
terrifying.
Yeah,
No, it's a terrible thing to do, and God will never create such a system where you
yeah.
cannot release and move on. And also to point out that for me, as I had children before I started processing my experiences, the PTSD emotion entered my children. It's now
Mm.
being passed on to them. So there is an urgency in me that um, we need to embrace what the PTSD journey is because multiple generations are affected.
And really by embracing the PTSD journey, we need to kind of completely change our approach to it
Absolutely.
in our mainstream medical model. Like
Absolutely.
pretty much do the opposite of everything we're doing, it sounds.
Absolutely. And to respect, because when you first start with a PTSD patient, their decision is, I will not remember. Don't you take me back there? And it was very traumatizing for me to realize one day, God, how could you do this to me? How could you make me go back? I have years
So,
of trauma and I'm going
so
to have to
how did you kind of
remember.
how did you get convinced to do it? What,
I stayed in the grief of of the anger and the grief that God will send me back into those places. I can still have more grief about it, that this is very traumatizing. But then I said, I will need skills, I will need help, I will need resources. I'm not going back in there empty. So that choice has really helped me to be open to support, which is from my guides. And then now I made a decision. I will go back into a memory so that my focus is not on the dark events and how alone I am, but that God was there. I want to go back into it to create the empowerment. So when I get a flashback, I will say to that little girl, remember, God is here. I'm doing this so I can see that. I want to see that God is here in this experience. I'm I'm in the experience, but I'm looking at what I'm choosing to see is my guides are here. God is here. The abuser's guides are here. That is my spiritual strength that I'm bringing into the experience of reliving the trauma, which is not exactly reliving. There's a change, there's a difference. But as
yeah.
you engage the journey, you will start to make those choices for yourselves. That what is my purpose of going back into this? For me, I have to release all the emotions about it, but also I want to bring a different experience to the child, which is not recreating the memory. It is, what happened, but that in the experience, there was more in it. I only experienced half of it, which is the darkness, but in it, God was there. And that is the peace I seek. For me, the peace, the forgiveness I'm seeking is that if I can feel how God was there, I will be at peace. I can accept.
So if
You have
somebody,
to really tap into a lot of personal power to go through it.
yeah. And so if somebody's watching this who does have PTSD and they feel very stuck in their management of it,
Yeah.
but would be feeling very resistant to kind of going back there and
Yeah.
remembering things, like
I'm with you. I
what
get,
would you tell them, why should they or why would they try another approach?
yeah. Um, Fear is the main emotion to start to work with. I will post a link to a video called Fear is Your Friend. I watched that video. I took down the notes on the steps given. I started to follow the steps. Took me a year to work through my block to fear, and then I started to actually shake and shake and shake. And I've been doing that 8 years now.
But
And
why should they?
yes,
Why should they?
for me, I saw what it did to my kids. The trauma has damaged my children. And my children
Your
may not
PTSD had
enter my
damage
children. Yes. Because
on
the
people.
emotion of the trauma has entered my children. They know what those experiences are like. They just don't have any memories. And they are living the wreckage of PTSD. That's their lives now. Their health, their social life, their careers, they are broken.
So
That's
you
my
having
that's
to
my
come to terms with how damaging the PTSD is, not just for you in your
no,
body,
no,
in your nervous system,
yeah,
but outside of you, you had
yeah.
to acknowledge that.
Well, the PTSD is created in me that I don't matter. I'm not doing it for myself. Oh, that's okay that I'm broken, but oh no, it's my children. So the PTSD has destroyed my sense of self to the point where I really believe that I don't matter, because that's what a traumatic event is, that you don't matter in that moment. Your well-being doesn't matter. And so a lot of PTSD victims may have to find the courage uh, in seeing how it's affecting other people, and to find the courage to go back into those places, um, and finish the experience. Basically, you're just finishing the experience. You had an experience, you haven't processed it, so it's paused, it's frozen. And while it's frozen, you're not yourself. You're just living there. I used to feel like I'm behind a plexiglass and I can't engage with the world. I'm just living the caricature of being a person, and
Mm.
nothing real can come out. Yeah. But it's mostly just the emotion of fear. Just focus on that one emotion and they can do it. And yeah, you have to see the cost of what it's doing to you and to people around you,
Yeah.
which we've been talking about in all the other videos, right? For yourself also, you started to see the pain of, well, you said in the first video, everyone's just using each other. And it was so painful for you that you developed this passion to do the work. So for me, it was about recognizing that emotion has entered my children and I have a strong desire to protect my children.
Mhm.
So that desire then kicked in, and here I am.
Yeah. Okay.
And we're meant to heal PTSD completely and come out of it with added resiliency and strength and courage from having gone through the experience. And that's something to look forward to.
Yeah. Yeah. So there's hope. There's hope.
Absolutely. Absolutely. Yeah.
Yeah.
Okay. Well, thank you for this question. This was a really good conversation.
Yeah.
And thank you everyone for watching.